Assalamualaikum. My name is Noor Raheemullah, and I'd like to welcome you to our discussion today, our National Healing Circle, but also a great conversation we're going to have about domestic violence, divorce stigma, mental health crisis in our Muslim community. With me today will be Dr. Rania Awaad, Ustadha Hosai Mojaddidi, and Saha Jamshed. I have a little bit of their bios and the organizations that are actually collaborating with us. We have Maristan, NISA, the Rahmah Foundation, and Muslim Women's Alliance, which some of you may know that's my organization. And I'm going to give each of our panelists an opportunity to speak, and they'll probably discuss their own organizations as well. But Muslim Women's Alliance is an organization that has been based here in Chicagoland for empowerment of Muslim women. And with this topic, I would like to say that we're here for the sake of raising awareness. Muslim Women's Alliance is there for our women to make sure that we are helping in many ways. Some of the ways that we've found are women who either lack financial stability or there's a gap in society when it comes to helping women who are emerging from these types of situations. We built the Khadija Fund to help women become financially independent. And we have the power of, sorry, one second. My voice isn't. Can somebody hear me? If you're using AirPods, they're not getting my hijab. Okay. Can you hear me now louder, or I'm bringing the speaker to me? Yes, that's better. Okay, so I brought the speaker. We have a speaker here, so I brought it closer to me. So I don't know where you've heard me from. Obviously, I'm going to introduce our panelists. But what I was saying was with MWA that, we have the Khadija Fund, which is a way to help women become financially independent and get out of situations. Maybe that is one way that we can remove a hurdle for women out there. And also the Empower Network, which I have, over time have heard of women. It's a support group to help women who are navigating divorce. We need to engage more as a community with women who are feeling isolated. I think with this topic, and I'm going to go forward and start the conversation, we've been hearing, especially all the time, cases of Muslim women who are struggling, cases of Muslim women who have had to go through horrendous situations of domestic violence. This week alone is, we heard the story of the family in Texas. We've heard the Milwaukee story last night. One of the ones that, here in Chicago was a young woman on Monday that was, killed by her husband. And I think it is a conversation that needs to not just be in October when it's Domestic Awareness Month. It needs to be something that's happening on a constant basis, especially in our community, because there are a lot of cultural taboos, cultural issues. There's a lot of, what should we do? What should we not do? And, how much do we get involved? How much do we not? How much do we hold people accountable? And I think a lot of women, feel that they need that support. And, these organizations, we're there, Maristan, NISA, the Rahmah Foundation, all beautiful organizations that are doing great work. Our speakers are amazing women that, I have been blessed to, know in previous years as well with the Muslim Women's Alliance work. Dr. Rania Awaad is a clinical associate professor of psychiatry at Stanford University School of Medicine and director of the Stanford Muslim Mental Health. Ustadha Hosai Mojaddidi, co-founder of Mental Health for Muslims and organizer, teacher, spiritual counselor, mentor, and mental health advocate. She's definitely an avid social media poster as well, because I feel like I get so much out of her posts. I get so much out of all of their posts, but definitely learn a lot. And then also Saha Jamshed, who is a licensed clinical social worker and currently practices as a mental health therapist at Access Community Health in Maristan. So I will give them an opportunity. I would like to start this conversation, what we're going to do so that everybody understands. This is open to all. So I know some people were asking in chat and questioning, asking in different groups that this is open to men and women. I think it's a very important conversation to have, not just amongst our women, it needs to be done with our brothers as well. So definitely brothers, sons, you know, sisters, mothers, everybody needs to be in this conversation. We are recording this so that if we can, you know, you can view this later. So if there's any need for not being able to stay on. And we're going to give an opportunity for each of the speakers to speak. And at the end, after all three have spoken, then we will open up, you know, there's some questions that I've already gotten free from some of the pages that I've seen and or some of our pages that I've seen. And I will open it up for questions from the participants as well. This is a webinar, not a Zoom conversation. So you will have to, those of you who may not be familiar with it, you will have to, there's a Q&A box and a chat box. Please keep your questions in the Q&A box so that we don't have to keep on reading the chat box just in case. So make sure you're using the Q&A box to throughout, and you don't have to wait. You can, we are monitoring the Q&A area, so you can write in your question and we'll get to it later. Don't think that we're not going to. If anything, if we get more of the same question, we're going to probably lump general, you know, questions all together, but definitely we'll try to get in as many as possible. All of these ladies have social media, so you can always reach them as well later on. Inshallah, with that, I will start with Ustadha Hosai. I'm going to go on.
Assalamu alaikum. Can you hear me? Uh-oh. Yeah, oh, you can hear me. Okay, alhamdulillah. Thank you. Assalamu alaikum. Bismillahir Rahmanir Rahim. Alhamdulillah wa salatu wa salamu ala ashraf al-anbiya'i wal mursaleen. Sayyidina wa maulana wa habibina Muhammad sallallahu alayhi wa sallam wa ala alihi wa sahbihi wa sallam tasliman kathira. Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. Thank you, Sister Noor, for the introduction. And as well for hosting or leading this conversation with us today, as well as my co-panelists, which I'm eager to hear from as well. Today has been a very somber day. Actually, past few days have been quite somber as news of these tragedies that have come out of Chicago and Milwaukee, Sister Sanya and Sister Alwiya Muhammad, who in a very short window of time, both of their lives were taken. Allah yarhamhuma, may Allah subhanahu wa ta'ala grant them both Jannat al-Firdaus al-Ala, and anyone out there who knows these sisters or is related to them, may Allah give all of you sabrun jameel. The impact of their passing has had, by now I'm sure, global reach. We've seen an outpouring on social media. I actually first came to hear of Sister Sanya passing on Twitter and was just completely devastated when I heard about what happened to her, and then ended up finding her TikTok page and scrolling through some of her previous posts, and it pained my heart so much to read what she had for over a year documented in terms of the hardship that she suffered, first in the marriage, but then the backlash that she endured from community, from friends, and in some of her TikToks, she actually had written content as well that where she explained what she was feeling, and she, clearly stated that the backlash was just so difficult for her because she was, judged so harshly for leaving the marriage and losing friendships, and just the struggle of being judged and not really finding a support system, the lack of support system. And this is something in my work with women over 20 years, and even in my own personal experience, having been divorced, I know firsthand that the stigma around the topic of divorce is something that is so prevalent, unfortunately, and pretty much every sister I've ever known who has gone through a divorce or even considered divorce. And just the other day, for example, I did an anonymous Q&A on Instagram, inviting people to share some of the challenges that they, or questions that they may have. And it was I felt that this would be, I knew that it would open up a lot of things for people because anonymity, right? So many people struggle, but to come out and speak about their struggles is difficult. So when I put this questionnaire out there, I expected a lot of very heavy questions or topics, but I was pretty shocked at the amount of responses I got, mostly from women who were struggling in their marriages. And this is, a constant theme, as I said, for over 20 years, not able to speak to a lot of the issues because they're so taboo, talking about all forms of abuse, physical, sexual, financial, certainly emotional, verbal, all of these types of issues came up in the questions. But these are things that for decades that we continue to see in our community, and the lack of support systems for these sisters only contributes to the stigma. The fact that when a sister is even considering divorce, she doesn't have an outlet or somewhere to go with those feelings where she feels safe. Because oftentimes, and I know because it happened to me as well, even the people closest to us, our family, our friends, they mean well, of course, and we always have to highlight that, intentions matter. They mean well, so they may minimize a sister's struggles. They may try to overemphasize other things and somehow, make her even doubt some of her concerns without fully understanding the context of what she's going through. And because some sisters experience that, what happens oftentimes is they just further and further shut down, and they don't reach out, and they don't call out for help because they don't know where to turn. So this is all a product of the fact that our community has a really difficult time with divorce. And if we look at historically, even in the time of the companions, even the Prophet ﷺ, his own daughters, these things were not as stigmatized in previous generations. And in other cultures, they're not as stigmatized, but in many of our cultures today, unfortunately, these are, even though we've come so far in many ways. For some reason, unfortunately, in this regard, a lot of sisters just feel like they have no place to go with these doubts and struggles that they're feeling. And so unfortunately, what often happens is they endure, and they're told, even from a spiritual perspective, they're told that it's better for them, right? That they should be patient. This is an often, common thing that I hear from sisters is that when they turn to the imam or the sheikh or the sheikha or the elder in the family or anyone that should be in that position of authority, what they're often told is to just endure for the sake of, and then they'll list many things: for the sake of the family, the sake of the children, the sake of your parents, the sake of your faith. And they'll say these things, but oftentimes what I hear, the feedback that I hear from sisters, is that their context is not fully heard or understood. We're too quick to shut down the conversation, and I think that really contributes to these unfortunate occurrences, which are, how many more do we need to hear of these horrible tragedies? I feel like just in the past few years alone, we have had one is too many, but we have had far too many of these incidences of domestic violence that have led to the loss of innocent life happen. And we have to really take this opportunity to mourn the losses and to grieve and to give these victims of abuse the honor with which they deserve, to know their names, to talk about the highlights of their life. We can do that, but simultaneously, as a community, we really have to address the core issue around why are women often pushed into these positions of silence, where they are their grievances are not taken as seriously, or they're when they do have legitimate complaints, they're often made to feel as though they have the burden to carry those issues, or to carry the weight of whatever they're enduring, because that is what a woman does. And I know I've heard that, sometimes these are generational, unfortunate, things that we hear from different generations that, oh, our grandmothers, our, previous generations, they had to deal with so much more, but they kept the family intact and they kept their mouths quiet. They knew when to be quiet. And these are oftentimes, this is the way that we feel as though we are empowering women. And it's quite interesting to me, and I find it's very it's wrong on so many levels, but I find it interesting that we've accepted that we're empowering women by saying these types of things, by comparing them, right, to women of the past or other women who may have endured a lot of things. And if that's our yardstick for a successful model of womanhood, then I think a lot of women would naturally feel, right, that they are deficient because they're not staying quiet, because they're not willing to martyr themselves for the sake of their family, for the sake of their children. And so all of these things we have to, as I think a community, really come together in these types of spaces, have a dialogue and try to rectify this, because we can't afford to lose more people. We can't afford to have entire families devastated for years. And the loss of one life is, as we know from the hadith, as if all of humanity has been lost. And this is a prime example, because now you have, imagine just the toll that these devastating losses have on the community itself, on our concept of marriage and what marriage is. I know I've seen this already in some of the comments on threads, a lot of people becoming further disenchanted by marriage. So we're just seeing these reactions, which are completely understandable. But I think at the core of it is the fact that the stigma around divorce continues, it prevails, and we have to really step back and say, what can we do more? And I think conversations like this, and making sure that we use language that is fair and is representative of our deen, because sometimes we infuse cultural ideas, right, cultural norms, cultural expectations into the conversation, and that also contributes to a lot of the confusion. But if we very matter-of-factly state that, yes, divorce is something that is permissible and it should be a last straw, but I think every single person in a marriage has the right to choose for themselves if they feel unsafe, if they feel that their marriage is, their rights are being abused, and so many other things. But I think every individual has to be given the language and the ability to make those decisions from the onset. And that's why, again, going back to how can we prevent these types of stigmas from continuing. Education is certainly an important part of the conversation. Premarital counseling has to factor in divorce. And I know that's painful. I mean, I've certainly, as a parent, I can imagine the last thing that I would want to talk about with my children when they are, inshallah, looking to get married is divorce, because it's such a negative word and it's so charged. And so we want to keep everything light and positive. But I do think that's also a failing on our part as a community to not emphasize what an unhealthy marriage looks like and what we can do to know the distinction between a marriage that is intact and doing well, excuse me, and a marriage that's not, and what resources individuals and couples can pursue to either try to salvage that marriage or find a way out. But I think that has to be part of the conversation around marriage. I don't think we need to, no pun intended, divorce the two topics, right? Where you get a lot of marriage talks, meeting people, and a lot of very, oftentimes these topics are separated, right? And then we talk about divorce as as an afterthought to these types of unfortunate events or statistics, as we see, unfortunately, more and more people headed towards divorce. But I think we have to do better and bring them together as real realities, and give people, especially those who are in situations where they don't have this access to this knowledge. And if you look at the statistics I was reading earlier, I think just today, they may have republished this article from previously, but a lot of organizations are addressing the topic of domestic violence. and other topics because of these unfortunate tragedies. But Sound Vision had a really interesting article that I was reading, and they had statistics about domestic violence and divorce, and so many of the people impacted are immigrants, people who are new to the country, who don't know their basic rights, and oftentimes don't know even their Islamic rights. So I think we have to, as a community, start taking the lead and really addressing these topics, inshallah, and giving all of our community members access to the knowledge that they have the right to have from Allah subhanahu wa ta'ala, which is to know what what they should tolerate and what they shouldn't. I mean, just the basic human decency, I think every single person deserves. And if you are in a situation where you are being verbally, emotionally, and God forbid, physically and otherwise abused, you have the right to speak up for yourself, to advocate for yourself, and to, if there is no other recourse, to leave that relationship. And that type of language has to be, it has to be shared over and over again, so that we never, or that we minimize the number of cases where sisters, and we have to admit as well that domestic violence doesn't just affect women, it affects men, it affects children, it affects other extended family as well, but that we minimize the numbers of these types of horrific tragedies to none. We shouldn't tolerate this anymore, and we really, I think, have a lot to do. And I'm just so grateful for all of the partner organizations for today's event. May Allah bless all of them. They really came together in a short amount of time. And I know many other women on the ground in different parts of the world who are working right now as we speak to put programming together to try to get ahead of these conversations and to provide the resources and the language and the information needed so that we never see these types of tragedies again. I'm actually really, before, subhanAllah, these unfortunate past 2 days, I was working with Sister Sana Subhani of Wasila Connections, who's based here in the Bay Area. May Allah bless her. We have a program coming up at the end of this month centered around women of divorce, because there are so many sisters, again, who in the aftermath of their divorce felt very alienated and isolated by their community, by their family, by even their friends. I'm working currently with friends of mine who are going through a divorce right now, and the same applies. And we need to create support groups. It's actually one of the biggest requests, I would say, over the years I've received from different sisters, to please put together support groups for women who've experienced divorce. These are the types of programs we need. So please support these organizations and these causes. And again, may Allah bless MWA, Maristan, NISA, and Rahmah Foundation for always being the lead on these very, very important conversations. Jazakumullahu khairan. I'm looking forward to hearing the rest of my panelists and also from the audience, inshallah. Barakallahu feekum.
Thank you, Ustadha Hosai. As always, you're really refreshing. I know that you spoke. I didn't know if I should speak on some of this. I think many of you who are on social media, the sister Sania, who had passed away, I think Ustadha Hosai had mentioned it. She actually did have quite a social, she was discussing her her journey of getting divorced, and to also be able to go through this process and some of the cultural taboos that have occurred for her in her life. And I'm glad you brought that up, because that has actually been a reoccurring theme of just in Urdu, the word is like, what are log kya bolenge, and in English it's like, what are people gonna say? And that seems to be something that's been hitting a lot of women who've kind of come to us, come to all of us, I'm sure, just with like its perception of, who are we pleasing? Who are we pleasing? Who are we staying in this marriage for? So definitely something that we will come back to. I will now move on. Again, any question? I know there's chats, and that's great. I'm glad we're having discussions for sure. Keep going with that. Again, if any questions, please post them in the Q&A box. And at the end of all three, we'll go through some of these questions. But thank you. We will move on to our next panelist, Saha Jamshed, and I think, sorry, I'm talking and the video somewhere else, but inshallah, I will leave it to you now. Thank you.
Assalamu alaikum. Thank you so much. I I want to thank Sister Noor for initiating this program and all the organizations that are involved, of course, because this is a really important topic that definitely we don't talk about enough. So my portion of the presentation is basically focusing on domestic violence. I'll provide a summary of what it is, and based on my work, I've been working with NISA for about almost 16 years now, working with survivors of abuse. We have a shelter, transitional home, and so I'll provide an overview of my experience and what, as far as what domestic violence is and how it presents itself in our communities. So the definition of domestic violence is basically a pattern of abusive behavior used by a person to establish power and control over another person. And this relationship can be a spouse, it can be parents of adult children, siblings. Of course, adult children can sometimes abuse their parents, and even in our communities, we do see abuse by in-laws. One factor to really keep in mind about domestic violence is the fact that there's a pattern. The incidents are not independent, not unique, and it continues to occur and reoccur. And also that there's usually a cycle of abuse that exists in these relationships. So the cycle would can possibly start with an incident in which an abuse occurs, which is often followed by what's referred to as the honeymoon stage. And this is when the perpetrator may apologize, bring gifts, promise to change. After this stage, we lead to the tension building stage, in which, of course, goes right back to the incident. And again, the cycle continues to repeat itself in relationships, right? And one of the reasons why it's so difficult for women who are, or men sometimes who are in abusive relationships, to leave is really the honeymoon stage, right? Because the promises, the apologies, oftentimes the victim will become really hopeful and kind of hold on to that, allow the abuse to continue or remain in a relationship that's abusive. Some types of different types of abuse that can exist in relationships may be physical, verbal, emotional, financial, sexual. And oftentimes when we ask community members to define domestic violence, oftentimes the main definition will involve physical, right? But of course, the verbal, emotional, financial, sexual does exist. And oftentimes, this is indicated by research as well as very clear based on my own experience working with survivors, is that the impact of the verbal, emotional abuse is a lot deeper and it is invisible. So it's not really, we often don't seek help. It's usually dismissed because it's not like a bruise, which would be caused by physical. So of course, I'm not in any way undermining the impact of physical abuse, but the verbal is basically silent, right, invisible. And of course, as far as abusers go, victims go, there are both men and women that are abused. So on average, 1 in every 4 women will experience abuse in sometime in their lifetime, and 1 in 8 for men. And usually for men, it's more, the abuse comes more in the form of verbal, emotional, and the physical abuse often is towards females. And one thing to keep in mind regarding verbal and emotional abuse is oftentimes it doesn't even end when the relationship ends. So when working with survivors in the shelter, oftentimes, especially individuals who have children, the verbal emotional abuse will continue for years because, again, there's some type of contact, there's some relationship that continues because of the children. And sometimes even when there are no children, of course, there's the verbal emotional abuse continues through texting, family members, threatening family members. So oftentimes it doesn't stop when the relationship ends. And what adds to the complexities of domestic violence is that oftentimes, as Sister Hosai put so beautifully, is that oftentimes they're abused by the perpetrator, but oftentimes there's also that backlash by family members or community members, right? Often the shaming, the labeling, the pressuring the victim to stay, to remain in the relationship, be patient. And that makes it often very difficult for a victim to actually leave the relationship. And it also leaves the victims feeling very sometimes confused. That's often actually a very common word that comes up when we are assessing victims of abuse, as far as how they're feeling, what they're thinking, and the challenges that they face. And of course, feeling alone, hopeless, depressed, anxiety. In addition, oftentimes survivors of domestic violence continue to live in fear. So studies, research indicate that the most dangerous time is when a victim immediately leaves the perpetrator, and a few weeks after. That's supposed to be the most high risk. And oftentimes, even when we have clients who come to the shelter for the immediate days following, we have the clients stay in the shelter. We really have them, we provide them groceries, food, and whatever they may need, so that they're not going out and about, because that's when usually the perpetrator will be enraged, looking for her, and also a lot more risk of like danger and harm. But in Sania Khan's situation, we see that it doesn't always work that way, right? They had been separated for over a year, and unfortunately, he was able to get back to her, and unfortunately, the tragedy took place. So what's really important when we're supporting survivors of abuse or individuals who are still in relationships is not there won't always be one approach in supporting, right? Looking at each case as a unique case and a unique situation, so that we're able to provide the best support. And also, and lastly, considering the since the pandemic, since COVID happened, right? So domestic violence is really considered or referred to as the shadow pandemic, because during the pandemic, the cases of domestic violence have significantly increased. And so that not only puts a lot of victims in situations where they're being abused, they're in harm, but also because the perpetrators are home because of COVID, most people are working from home. And that also really prevents these victims to seek support. And so oftentimes, it's reported that they feel trapped in their own homes, right? Even in the past, generally, it's very difficult to seek support services when you are in an abusive relationship because of the control, the monitoring, the isolation. Oftentimes, these victims may not have access to phone, to computers, or any means of really contacting with the outside world. But with the pandemic, that's actually even gotten more difficult. I think, when I was actually preparing for this presentation, I asked myself, and this is something, of course, we get asked oftentimes from community members, what do we do? What can be done to help the victims of abuse, to really help the community become more educated, informed, and so that to stop abuse in our communities. I would say, first and foremost is really talking about it, right? Oftentimes, domestic violence in our communities is considered a private issue. I would say since I first started with NISA many years ago, I think there's been a lot of progress made in our communities. Many years ago, we wouldn't even really be invited to the masjids to talk about it. Alhamdulillah, there's been a lot of progress. So really continuing to hold these forums, these conversations about domestic violence, and addressing it specifically in the masjids, because studies do show that majority of victims, actually the first point of contact to seek support services is usually an imam, right? So the masjid is really where a lot of these victims turn to imam. So having these programs in the masjids and educating our imams about domestic violence and how to respond, I think is really, really very important. I would also, I will also add that I think it's really important for us to do more as far as engaging men in these conversations. In the last few months, I've had a few presentations where, like, honestly, I've been really disappointed to see that there may be, 50, 70 attendees, participants, and maybe like 2 or 3 men, right? And I think that needs to really change in the community for us to really have a strong impact, right? Because again, since most of the perpetrators are men, of course, there are men who are being abused, as I said earlier, but I think it is really important for our brothers to get involved in this conversation. And also, as Sister Hosai again explained or summarized so beautifully, was really providing support to individuals that may come to us for help, who may be in abusive relationships, in a way that's non-judgmental, not shaming them, not pressuring them to stay in these abusive relationships, but really being familiar with the support services that are out there, and empowering these victims by providing information, providing resources, so that when they're ready to take these steps, right? Oftentimes we also tell community members not to tell the survivors or the victims what to do, but rather there's help, providing them resources and really giving them that space to determine when they're ready to seek these supportive services. And lastly, I would like to add that I think as a community, we really need to focus more on having programs, batterer intervention programs, and really investing into that. There are a lot of programs that provide services to the victims. And I'd say, there, as far as what we do and what we're able to kind of direct the perpetrators towards, is really very limited. So I think, having these conversations about how can we improve those supportive services, so someone who is in that situation, who may abuse, their wife or anyone whom they're in a relationship, that they're able to seek services and change, right? And of course, the conversation, I think, needs to continue, as I said earlier, because the more we talk about domestic violence, we hope that the stigma for victims as well as the perpetrators are removed, right? And thank you very much again. I think, alhamdulillah, it's great that we're having this conversation, but as Sister Hosai said, let's continue these conversations, not only when these incidents happen, but ongoing, so that we can continue to create change. Thank you.
Thank you for a very informative conversation. I learned a lot. And it's unfortunate, some of the statistics that are actually you were speaking on as well, in our community and, everywhere, to be honest with you. But I am looking at some of the questions, and I think a lot of them we will try our best to get to, but I would like to, I think some of the general questions that are coming about, I hope, we all have our handles, and we're kind of putting that in there. Please, I know that Rahmah Foundation put their information, WA did, Ustadha Hosai and Sister Saha, if you can, in the chat group, if you can put your information, your website for your organizations, that would be helpful. I think we will try our best to get all the questions, but some of the things that I'm kind of seeing on this is definitely your masjids in Chicago. Muslim Women's Alliance is already speaking to some of our organizers and our groups that are here. I don't know, because I know this group is, some of the ladies are from the Bay Area. definitely something that we do need to hold our masjids accountable for. So I think that is something that we need to have these conversations keep on going. We definitely, again, not just have it in October, but have it throughout the year. Women, we are the ones who are going to be standing for women. That's just plain and simple. So this is why organizations like ours exist, and we do need help. So if you are in these different cities, you are involved in your masjids, these are ways where women can show up, is making sure that these topics are discussed in your local masjids, are discussed at your local level. So we, so it's definitely, and there's ways that we can kind of help you through it as well. So everybody's going to be posting their organization's Facebook and their groups, and so we can help you throughout this. From now, I'm going to pass it along to Dr. Rania Awaad, and we will then go into question and answers. Dr. Rania.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Thank you so much, Noor. And my thanks to everybody who's come together to kind of put this program, this pop-up healing session. Inshallah, as you've heard, Ustadha Hosai, Jazakallah khair, Saha, and then myself, each of us will be giving some remarks. But really, after this, I hope that the many questions you have here, and for all of us to really have this incredibly important discussion, we just felt that it could not wait any longer, and that this healing space needed to be here for all of us. And so I'm praying, inshallah, that you're finding some help and hopefully some healing. Bismillahir Rahmanir Rahim. Wa sallallahu ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. My sisters and brothers, the part that I'll be bringing to the conversation, and I was really particular about wanting this program to have multiple voices in it that spoke from different angles, whether that be the spiritual conversation, whether it be a mental health conversation, whether it be about intimate person violence, or whether it be related to your own, whatever is causing you to come into the room tonight for healing. Now, the part that I want to specifically focus on and the angle that I'll be speaking on tonight has to do with some heavy things. And so I'm going to first issue my trigger warning by saying that I will be discussing some of the heavier things tonight, and inviting you that if it feels heavy, feel free to take a step back, and if and when you're ready to join us, inshallah, again. And we will definitely be putting resources for help for all of the things that have come up tonight. Now, we've talked about divorce, we've talked about domestic violence. There is a term that I just mentioned that I'll define what I mean by intimate partner violence, which is similar to domestic violence, but it's a bit of a broader category because it does not necessarily have to be domestic, but it is a form of many forms of violence. And then also the topic of suicide and homicide, murder. And in the context of that murder, also somebody then taking their own life. In the cases that you've heard in these last many days, they have been the life of the abuser was taken in suicide. But sometimes it happens the other way too, where a person who is being abused feels that there is no other way out except for ending their own life. And because of this, these are all very heavy conversations that I really wanted to bring to the table important discussions, including statistics and definitions. And then we'll see very clearly, I hope, how all of these are very intertwined and interconnected, even though sometimes we think of them separately. And sometimes we don't think they really pertain to our communities, but they do. So this term that I use, which is called intimate partner violence, or IPV for short, is not just physical violence. It's also potentially sexual violence, and certainly can be psychological violence or harm as well. Here in the United States, the statistics on women who die or by homicide, who are murdered, are often accompanied by IPV, or intimate partner violence. In fact, that number is about 1/3 of all women in the US who are murdered have had domestic violence or intimate partner violence that led up to that murder. Survivors who have actually survived, who kind of were not murdered, but definitely experienced abuse at the hands of intimate partner or domestic violence, are twice as likely as others to attempt suicide. These are really big numbers and important numbers, and then you start to see how much they're intertwined. And then the cases of murder, suicide, like what we heard in the last week. And subhanAllah, I'm traveling at the moment, and in the not too far from where I'm currently, 15 minutes away, the neighboring masjid, just a few months ago, had a very similar case to the ones we were talking tonight, in which, there was domestic violence in the home, the husband murdered the wife and a child. And when we talk about these terrible, incredibly horrific tragedies, you realize that these homicide, suicide conditions, occurrences actually often happen in the context of abuse. And this is why it's so important to have all of the angles brought in. I saw in the comments people saying, are you going to reduce everything to mental health? No. But is mental health conditions sometimes a part of this? Yes, absolutely. Are we going to reduce everything to cultural shame and stigma? No. But is it often a part of many of these cases? Yes. Are we going to reduce everything to men versus women, or women versus men, or the imams don't understand, or so on and so forth? No. All of those would be very reductionistic ways of thinking of this case, these cases. And this is why you have multiple voices up in the room tonight, speaking from multiple angles. I want to make sure that all of us here tonight understand that even though sometimes the domestic violence field and the mental health field work separately, they're actually incredibly connected. And more recently, they've been working together more and more often. These are actually two separate fields that kind of work in isolation from each other. And I'll tell you what I mean. When somebody who comes to a mental health professional and says, I've been having suicidal thoughts, it's not often that that person will get asked, are you also experiencing domestic violence or intimate partner violence in your life? It's not the first thing that always is asked or comes to mind. It turns out, though, that if that is not asked, we might miss a very important red flag in that person's life, now that I've shared the statistics with you. Also, the other opposite thing happens as well. Somebody might come to a social worker or to the shelter or to a friend or a family member and actually finally have the courage to say that there is in fact abuse happening in their home or to them. And the first impulse that most people have is to try to help them solve the abuse. But it may not necessarily be to ask, are you also feeling suicidal? And so we miss these red flags sometimes, subhanAllah, even though they're very much connected to each other. And there really is a genuine risk of harm to both the perpetrators and to the victims. Also, I've seen this happen like in the emergency room where somebody comes in for a suicide attempt, and it may have been because of intimate partner violence, but it's often that they're not being asked, is that actually the case? And so they go right back into the situation that is actually dangerous to them. And so, I really wanted to say that when people have been asking in the chat, and we'll get to this inshallah QA, how do you respond? What do you say? How do you help? One of the first things that needs to happen is non-judgmental empathy. It is really important to not try to solve a case. So many of us immediately kind of want to roll up our sleeves and go into problem-solving mode. But I want to remind you something. Somebody who is in a domestic violence situation and seems like they're stuck there, there is usually a reason why that's the case. Because it's very easy for us on the other end to say, why don't they just get up and leave? But there's usually a very complex web of things that are happening. Sure, sometimes it's cultural, and sometimes it's financial, and sometimes it's a person cannot figure this out on their own. But sometimes it's actually none of those things, and it's in fact psychological. There's a term that I want to introduce to us tonight, and it's maybe some of you know it already, but it's called traumatic bonding. Traumatic bonding is this complex psychological connection that a person might make or develop kind of over time, steadily over time, with the very person who is abusing them. And again, that abuse can be physical, it could be sexual, it could be psychological, it could be financial, it could be emotional. There's many different forms of abuse. And usually that abuser is highly, highly manipulative and controlling. So much so that a person that's in that trauma bonded relationship don't even realize that that they've been trauma bonded in that way. And it becomes, until that connection becomes so strong that sometimes it's difficult to break, but not impossible. And sometimes it's really hard to recognize it or even admit it. And then when a person finally wants to leave, right, kind of gets to the point where they decide enough is enough, either I might get harmed or my children might get harmed or someone else might get harmed. Ending that trauma bonded relationship or any violent relationship can be very, very challenging, but it could also be dangerous. And I think that's what you've been hearing in these last many cases, unfortunate, horrific murders that we've heard. So when a person is considering leaving an unsafe relationship, those of you who have been asking, what can I do to help? What do I say? A lot of it is support of the loved ones around that person that's going to help, and certainly professional support. And I say that because unless you've been trained for the number of years of how to hear out or see the red flags or kind of discern that, or even help in the most vulnerable moments of that person's life, you may inadvertently say or do something that's actually not very helpful. And not because you meant it, but just because it's a complicated situation. And that's why professionals are trained to do what they do. And so I want to remind us of that, inshallah. But I also want to remind us of a couple of other important things. And then I'd like to really give time for all of you to have discussion with us and questions, inshallah. I mentioned a little bit about suicide. And some of you are aware that for the last many years now, I've been focusing heavily a lot of the research that I do in my lab, the Muslim Mental Health and Islamic Psychology Lab at Stanford University, on the topic of suicide, because clinically and anecdotally, we were seeing that the rates of suicide attempts amongst Muslims were going up pretty high and steadily. And we did a big study, published it recently, some of you are aware of that as well, that showed that that number is pretty high. And that was all pre-pandemic data. We've repeated the study, and I won't bore you with it, and we're not even yet ready to publish it, but when we are, all I can say is, once the pandemic came in, those numbers don't look any better. And so, is there a crisis in our community? Yes, there is. What are these crises? There are many. And it does not help to deny them. It doesn't help to put our head in the sand. And it does not help to say, that's not part of our community. And it certainly doesn't help to victim blame or to point fingers or to say they did, she did, kind of like that scarecrow, like everyone's pointing the finger at the other person. Rather, I think what's going to really help are the trainings that are happening. It's the inviting conversations like these. It is inviting the trainings and the discussions right into the masjid spaces. It's holding our leaders accountable and making sure that if you have a leader in your community, whether they be the imam, a spiritual leader, or they be the board members or community leaders, or whether you are a leader, even the Sunday school teachers and youth group leaders need to be held accountable. That if you're going to have the label leader on you, then you have to take the courses that help you be that frontline responder in the community, whether it's domestic violence, or whether it's how to properly help our sisters and brothers who are going through difficult times, whatever it may be, or whether it be related to heavy topics like those about suicide and other issues. And so I encourage us, inshallah, to really, I hope, if anything, we're kind of have a renewed sense of intention, being very intentional about wanting to learn about the red flags, wanting to figure out how to help. I do hope that a lot of the work that's going to come is what we call upstream, which basically is prevention work. That we are no longer, or not no longer, but just we don't spend so much time doing reactionary downstream work, which basically is every time a crisis happens, everybody goes, oh my God, subhanAllah, and we suddenly have to, run around ourselves and kind of do programming that's right in a crisis moment. There is room for this, and it will always happen because tragedy is part of our human condition. But honestly, my sisters and my brothers, please hear this, that if we spent more time doing prevention work upstream, that if we did more education upstream, that if we brought these discussions and had these support groups and brought it into our very masajid and community centers and spaces and our third spaces and so on, there would be a lot less of these cases, in that there would be just more prevention work that would have happened. We would catch people earlier. I know this without a shadow of a doubt related to my own field, which is mental health, and some that I focus on, like the topic of suicide. Without a doubt, these interventions and prevention work is massively important and highly undervalued and represented in our Muslim communities. And so I hope, inshallah, this has been at least somewhat of an enlightening conversation. I hope there are terms and concepts that were discussed here tonight that you feel like you can walk away with knowing that you've learned and that you can take back to your communities, because I realize people here are from all different communities, mashallah, and you're here for different reasons. The tragedies have touched you in different ways. And so with that, I hope, inshallah, we can open our Q&A and bring back Ustadha Hosai and Sister Saha into the conversation. And I do want to say one more thing before I go in my part here. We have been recording this part in terms of the factual knowledge pieces around divorce, domestic violence, suicide, homicide, mental health. But we will be actually shutting the recording for the Q&A portion so that you can feel free to bring up whatever you want to bring up, and we can talk more openly together, inshallah. So that, and this is what we do at Maristan, every month just about, or whenever there is a community crisis and tragedy, we have these pop-up healing sessions, or we have scheduled monthly healing or educational sessions. We call them healing circles and educational circles. And we invite you, they're free, they're open. And typically the first part will be like this, in which there's an educational piece. And the second part is usually a healing space in which you can write your questions, or if it's a small group, even unmute and discuss with us directly. And you have the professionals or experts there to discuss with you. So if you're not yet subscribed to Maristan's mailing list or to its social media, please do, because I think that these conversations need to keep happening. And alhamdulillah, there's a resource for you to continue this conversation. Barakallahu feekum, walhamdulillahi rabbil alameen.
Thank you, Dr. Rania. It was, I think, and I'd like to invite Saha Jamshed and Ustadha Hosai to also open up so we can start our Q&A, because I know there's been a lot of questions coming in, and the information that Dr. Rania just presented to is very heavy. And she did warn us, that it is, and it's hard to hear, and it's also good for us to know too, I think, some of these points of just how we receive information from people, from women who are going through these types of situations. It's very important for us to be listening, not always, I want to solve, and that's the nature of us, right? But sometimes, and what I'm hearing from other women who are going through this too, there's that loneliness that many women are feeling, and that need to have support groups. I'm seeing this in a lot of the questions that are being asked as well. A lot of support groups. I'm going to put in what the MWA's page name is for Empower Network. And as Dr. Rania said, that they're, all the other organizations that are on this are welcome. We're putting our information in there too. You can obviously learn from all of our groups. Let's get to the questions. I do have a recurring theme that I'm seeing from a couple of the questions, and I want to kind of come out hard hitting a little bit. Now, we've talked a little bit about some of the stuff that's happening in our community, but let's ask, because one sister, and I forgot who asked it or said it, I think, yeah, the sister